Dr. Paul Farmer is no utilitarian. He sees each human life as valuable as the next. So, even when resources could be directed toward a larger group with a greater chance of recovery, Dr. Farmer questions how those who are impoverished and with little means for medical support are supposed to get by. In his many trips to Haiti, Russia, Peru, and to other nations where his expertise is needed, Dr. Farmer has consistently advocated for the rights of his patients, from the young and innocent to the old and incarcerated. He has also been a vocal critic of international efforts to combat diseases such as TB. Previously prevailing methods did not address the drug-resistant strain of TB that more often affects the poor. Dr. Farmer knows his patients intimately. He lives among them. This is integral to his understanding of his patients' varied and complex cultures. As an anthropologist, Dr. Farmer observes his patients and can more easily address their concerns. He sees the intersections of politics, spirituality, economics, and disease, and he comprehends these intersections at a profound human level. When his projects are criticized, he acknowledges his opponent's view. He does not expect his endeavors to be replicated, but he does want other doctors and those who provide care to nurture their commitments to their patients. His efforts come at a great personal cost. He sleeps little, sacrifices the comforts his skills and expertise afford him, and sees his family infrequently. Dr. Farmer is completely immersed in his duties as a physician. His dedication reflects his belief that medical caregivers should be fully accommodating for their patients, and their lives should be as valued as one's own. Dr. Farmer derived his philosophy from Virchow. Virchow evaluated that epidemics often followed social upheavals, and he developed a comprehensive view of epidemiology. If disease is an expression of individual life under unfavorable conditions, then epidemics must be indicative of mass disturbances of mass life. He suggested full democracy as a cure. As Dr. Farmer has seen in Haiti and in other areas where disease is virtually unhindered, political failings are a root cause of the people's suffering. Dr. Farmer asserted, "I think that the rich can always call themselves democratic, but the sick people are not among the rich. Look, I'm very proud to be an American. I have many opportunities because I'm American. I can travel freely throughout the world, I can start projects, but that's called privilege, not democracy." Dr. Farmer is keenly aware of the most potent conditions which harm people and their health. Medicine, to Dr. Farmer, is an instrument of good, and it exists for the benefit of those in pain, not for those merely seeking a living. He does not do his work for the sake of achieving prestige or of attaining wealth, but rather for the purpose of helping his fellow man. He has said, "I have fought the long defeat and brought other people on to fight the long defeat, and I'm not going to stop because we keep losing. Now, I actually think sometimes we may win. I don't dislike victory. You know, people from our background, we're used to being on a victory team, and actually what we're really trying to do in Partners in Health is to make common cause with the losers. Those are two very different things. We want to be on the winning team, but at the risk of turning our backs on the losers, no, it's not worth it. So you fight the long defeat." The physicians are the natural attorneys of the poor, and the social problems should largely be solved by them. In Dr. Farmer's view, societal issues are deeply intertwined with ailments and diseases, and those condemned to a low standard of living are also condemned to lives of frail health and susceptibility to harrowing maladies. But, as Tracy Kidder, author of Mountains Beyond Mountains, noted, "I think Farmer taps into a universal anxiety and also into a fundamental place in some troubled consciences, into what he calls ambivalence, the often unacknowledged uneasiness that some of the fortunate feel about their place in the world, the thing he once told me he designed his life to avoid." Dr. Farmer ardently abides by evading ambivalence, and we should do the same.